Hey guys. Whoops. What am I doing? I'm taking pictures or something. Okay. I'm gonna read this report. Um, okay. I'm gonna leave out the name. So let's call him Dookie. Okay, Dookie. That's a good one. Alright. So this is a clinical summary on Dookie. He is 22 years old, white, single male, who has been under my professional care for 5 months. He was first seen on March 8th of this year for presenting with a severe major depressive episode with suicidal thoughts and self-mutilatory conduct by causing cigarette burns in his arms. This presentation was precipitated by not being able to engage in a romantic relationship with a girl that he had still is falling in love with. He was hospitalized for about a week and was discharged for ambulatory treatment with several medications. Through the first months of ambulatory treatment, he displayed abnormal behaviors like drinking alcohol excessively, smoking cigarettes excessively, sometimes running away for a day or overnight. On one occasion, he showed up disheveled very early one morning after a night of drinking and a fight with somebody. These erratic behaviors stopped when his uncle-in-law and one of his cousins set limits for him. Cousins described him as a child. Dookie, sorry, that's what I thought of. That's the first thing I thought of. Came to Honduras from New Jersey, his town of residence, when his mother sent him to stay with his aunt and her family. This was done because his mother could not deal with his behavior at home in New Jersey. This behavior included conducts like running away for up to a week in his mother's car when set to run a simple errand. Spelled wrong. Spending time away drinking and being with prostitutes up for a week in the company of an uncle. Staying overnight in nearby hills and returning dirty and starving. On one occasion, he spent a day or two in jail for stealing a motorcycle with a friend, and on another occasion, the mother was fined by the fire department because at school, Dookie set off the fire alarm with no reason but to show up. Ever since his childhood, Dookie had conduct problems that were deemed to be ADHD and was for some time treated with Ritalin. More recently, in the States, he was in psychiatric treatment but refused to follow up and take his medications. Just making sure it's still on there. His father died about 3 to 4 years ago. Dookie found him lying on the floor. His father worked many hours every day and rarely had verbal interaction with his family. Dookie's mother has never been able to set limits for him. His 2 older sisters have had some problems. Dookie has an ability to develop relationships with other men who have behavioral problems, and even when he wants to very much, he cannot develop a meaningful, lasting relationship with a girl. He used to work for another uncle doing electricity work, and one day he was sent to deliver some mail, and after doing so, he went home and never returned to work. Dookie cannot think or imagine any long-term goals. After being somewhat more stable, the patient was psychologically reevaluated and retested. The results of this showed that besides this dysthymic disorder, clinically he suffers from Asperger disorder according to the DSM-4 criteria, although in the Ritvo scale, he scored 60 when 65 or higher is necessary to make the diagnosis. But regardless, he was still diagnosed. Besides, the testing showed borderline and antisocial personality disorders. His total IQ is 112. Lately, he has been behaving more or less within normal limits with his family supervision, but has been displaying some depressed mood over his female friend, who he stays in touch with through Facebook. Dookie is now going back to New Jersey with his mother, who has been helping him find professional and social help for disability. His current medications include Paxil, 15 milligrams, and Revitral, clonazepam, 2 milligrams. Dookie is very likable and very liked by women for his good looks. He speaks rather little and softly, but is able to engage in conversation where he doesn't feel challenged or threatened. He is not hostile or aggressive at all. Dookie needs long-time treatment with psychotherapy and cognitive behavioral psychotherapy, and maybe in the future psychodynamic therapy. And this was from Marion Mendoza, MD, psychiatrist, Honduras Medical Center, 2012. And it's stamped and everything. So, and then we have the prescriptions. Yep. Okay, so I'll do another video expanding upon this, and just stay tuned. Thank you. Like, share, and subscribe. Bye.